Joining me to discuss is Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Dr. Moore, good morning and nice to see you.
Morning. Thanks for having me on.
So last year, we saw an early peak in flu cases. What is the current state of the respiratory season this year?
Well, thank you so much. Influenza is now following a more traditional pattern in that it's starting in December and accelerating, and it's going to accelerate sadly through our social time of year and the new year, and hence the reason we really need all Ontarians, Canadians best protected against influenza heading into a time that will lead to high risk of transmission.
So it's not too late to get a flu shot.
So now is actually, this week would be a very good time if you've procrastinated, if you've put it off, or you have questions you want answered. Now is the time to get those questions answered, because it takes 10 to 14 days to build immunity once you've had the vaccine, and that would best protect you for this very vulnerable time as we go indoors and socialize with older members of our community.
And what's going on with COVID-19? Are we seeing an uptick right now?
Yeah, sadly, COVID isn't tired of us, even though we may be tired of it. It is very active across Ontario. We've got a strong wastewater signal, strong positivity, and sadly, it's still having a significant effect on the health of Ontarians through high hospitalization rates, 1,800 in hospital as we speak. I want to thank the Ontarians that have come forward. Roughly 1.8 million Ontarians have gotten the XBB vaccine, and 40% of those that are over 60, but we still need that 60% of over 60s that haven't come forward to please consider getting vaccinated as we head into a high-risk time.
And what do we need to know right now about RSV?
It as well, I'm sorry to say, is still active across Canada. In Ontario, we have over 200 individuals in hospital as we speak. Half of them are 0 to 4 years of age, and the other half are over 65. So we still need to take all the basic precautions of staying home when you're sick, covering your cough, good hand hygiene, which will protect against all of the virus strains. But be very careful about the very young as well as the very old as you move indoors into social settings.
So with the holiday just around the corner and people getting together more, what is your advice to people in addition to getting their vaccinations in order to protect themselves and their loved ones, Doctor?
Oh, all those layers of protection that we've been using over the last 3 years still will work, Marcia. So good hand hygiene, staying home if you're sick. Please miss the social event if you've got active fever or cough, because we don't want transmission to our loved ones during that period of time. As well, if you're vulnerable to this virus, immune suppressed, have any underlying chronic illness, as you go indoors to crowded public spaces, wearing a mask will still protect you if it's well fitted in those high-risk settings as well. So all of those layers of protection will still help us against all of the viruses for this winter season.
I'm seeing a lot of people, Dr. Moore, still wearing masks.
Yeah, that's still helpful. So in the malls and on the subway, I've been seeing people wear masks. As influenza rises, masks will be very helpful. It's less infectious than the other viruses. And we know when we wore masks the last 3 years, we absolutely brought influenza under control and had low infectivity from influenza. So we know it does work, and it will help protect those that are the most vulnerable.
Dr. Kieran Moore, he is Ontario's Chief Medical Officer of Health. Thank you so much.